So imagine learning at an early age whether or not you're predisposed to many diseases, including Alzheimer's or heart disease. Dr. Mitch Goldman joining us now with a look at this fascinating new finding and a local company that is kind of the trailblazer when it comes to this.
It really is. The local company is Pathway Genomics, and for the last year, we've been able to test literally our genetic history and our predisposition to diseases. And all you have to do is literally spit into this vial, mail it back to the company, and in about 3 weeks, you're going to get a lot of information. You'll get information not only on what your ancestry is back to 150,000 years, so that you could be related to Thomas Jefferson or Marie Antoinette or some person.
Well, they're a little younger than 150,000 years, but
okay. Well, we didn't know like Fred Flintstone or someone like that. But then the other thing is we could figure out what diseases we're prone for. When I did my testing, I'm actually prone to develop malignant melanoma. So I'm going to be even more careful about putting sunscreen on.
But is this really something new? Because I was at my doctor and he says, you know, I'm probably prone to have high blood pressure because there are other members in my family that have that. So what makes this different than what we've heard?
It's not just taking a family history to figure out what you're prone for. It's actually looking at your genetic markers. So you can take a genetic blueprint, which you're seeing here being done, and that can actually show you all of the diseases you're prone to. But not only that, there are a number of medications that we can take, and this will also tell you if the medications are going to be successful or if we need to change the doses, because in the United States alone, about 100,000 people a year have a screw up from taking the wrong medication at the wrong dose.
That said, really quickly, say you have Alzheimer's, that's in your, you're genetically prone to have Alzheimer's, and you find that out. Is there anything you can do about that?
Live it up. No,
okay.
But no, there will be things that we can do to minimize the extent of Alzheimer's. But the key ones are diabetes, you know, is really key. Blood pressure problems, heart disease, skin cancer. Those are the key ones we can prevent.
And then that said, it does tell you what sort of drugs you can take that would help you out with a lot of these diseases.
But more important, what drugs are going to be better for you and what drugs are not going to be good for you. So there's blood thinning drugs that some people are sensitive to, having allergic reactions. This will tell you when that's the case.
Yeah, and I mean, is it an expensive thing? You're just spitting in a vial, but how pricey is something like this?
It's like less than the price of a cell phone. It's a few $100s, so it's not outrageous. This type of analysis used to cost thousands of dollars just a few years ago, and so the company here has really done it right. But even more importantly, the information is so extensive, they have genetic counselors to help you try to figure out and make sense of what this information is.
That said, extensive, but how accurate? Is there like a scale that you can say or not?
They do have a scale, and the scale, it's a validated finding. So they can tell you if it's going to be very accurate or if it's just a hypothesis.
Okay, great. And
we have good stuff.
Yeah, it's fascinating stuff indeed. In fact, we have more information on it on our website, fox5sandiego.com. Company's called Pathway Genomics
right here in San Diego.
Yeah, they are trailblazers in that. Dr. G, thank you.
Good to see you.
All right.